Greetings. My name is Steve Short. I'm a physical therapist, vice president of sports medicine with the Denver Nuggets basketball team. I want to thank the Duke Center for Excellence of Manual and Manipulative Therapy for letting us review our clinical commentary published in IJSPT, a clinically reasoned approach to manual therapy in sports physical therapy. Very briefly, just the intro on why we created this topic and review some of the current concepts and apply it into our setting and bring it all home. Another thank you to the co-authors and the conception of this paper, and although it's a low quality of evidence, we just wanted to give insight into the daily practice of sports physical therapists. So Matt and Dylan, when we're sitting in the training room discussing the litany of interventions that we can provide to an athlete and across the spectrum when we're managing injury, ankle sprains, low back pain, hip impingement, soft tissue soreness, and things of that nature, we keep coming back to manual therapy. The fact of the matter is athletes are often over-exercised, and we're providing education and exercise intervention and working within multidisciplinary care. And oftentimes we can't provide more and more exercise and continue to overload tissues. And we're just trying to create a more pleasant pain experience and athletic experience for these athletes. And what types of interventions are safe, time and cost effective, and we kept coming back to manual therapy, and we want to compare this against maybe some electrophysiological agents, things of that nature, things that may have been compared in other studies, things that come across our disposal when we're in a training room, and between what is time cost effective. These athletes are getting pulled in different directions, be it skill development coaches, strength conditioning, appearances, other demands between the family, and we need to provide an intervention that is safe, effective, is evidence-based, and can continue them to allow them to have the most effective and positive athletic experience that we can. And so we kept coming back to manual therapy. However, there are some challenges with current state of manual therapy, and a lot of that is historical in nature, right? If we're providing over-reliance on these therapies, if we're creating negative nociceptive language that is negative to their outcomes and their experience and causing an over-reliance, might be related to stating that somebody is out of place or out of alignment, that we're breaking up adhesions, things of that nature, things that is dated and is probably negative to our patient experience and to our clinical outcomes, we probably shouldn't be imposing those methods. So as treating therapists, we need to be brought up into the current mechanistic reasons why we're applying manual therapy in addition to supportive outcomes in various pathologies. So we just wanted to reference this figure that's in our article, understanding that the context and the neurophysiological mechanisms that are at play to hopefully improving our outcomes and creating a positive pain experience for our athletes. So when we look at that in practice, really that comes down to having some dynamic clinical reasoning within a feedback loop, right? We want to assess some key impairments that we're going to be treating. If we decide that we can impose an intervention that both us and our clients have good confidence in, and we come to agreement and we educate them on why neurophysiologically that these techniques are going to work, we impose that. We retest to see if our techniques and interventions made a difference. Again, reinforce with exercise and education, and continue along, noting that if we do not see the improvements that we like, we might choose a different technique or even a different modality if need be, and continue to test, retest, and reassess, and always promoting activity and education to go along with our manual therapy. And again, avoiding some of the dogmas and challenges that we've been, not utilizing words that harm, but utilizing words that heal, having an honest approach of why our interventions are working, that we're applying a mechanical stimulus for a neurophysiological effect. And what matters is that you feel a little bit better, maybe not necessarily 100% why structurally that this could be causing benefit to your body as an athlete. And as we look back and apply this in an athletic training setting and a sports physical therapy setting, we need to appreciate the history, right? We need to appreciate the fact that these manual therapy techniques have been around for a really long time. Unfortunately, some of the language and some of the challenges and some of the thought process is still out there, and we're working to update that appropriately within all of our spaces, orthopedics and sports. So we appreciate the fact that history brought us to this point, and we want to improve upon it, right? We want to update all of our practice because we don't want to throw out techniques that have been helping people for a long period of time, something that's cost effective, something that's been shown to have advantageous effect sizes and improve patient outcomes. So we want to utilize these techniques. We want to modernize our practice and apply it appropriately. So that being said, when we're applying these techniques to our athletes, we want to have our current best understanding of the mechanisms of why they work. We want to test, retest. That starts with a great assessment and being completely honest with ourselves as clinicians and with our patients. We want to reinforce that with education and exercise and keep people playing and doing the things that they love to do. If you want to dive deeper into this article, we have the link right there. And please feel free to reach out if you want to continue this conversation further. Thanks for your time. Have a great day. Onwards.